Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. In this video, I want to talk about recovery from heart surgery. Now, there's two different types that I can talk about. I've had both. One is transcatheterization, where they basically go up through your leg and do whatever repairs they have to there. Obviously, a lot easier than the one I'm going to talk about, which is open heart surgery. Now, 18 years ago, at the age of 42, I was shocked to learn that I needed to have emergency heart surgery, a double bypass. Okay, it was not looking good for me. My time was running out, and that's as TikTok safe as I can put it. So there wasn't a whole lot of preparation for me to mentally prepare for, because I was being rushed around like crazy to get me ready for the surgery the next morning. However, once I woke up, I was dealing with a lot of pain. So my first advice is to make sure that you stay on top of the pain, stay ahead of the pain. Don't be a hero. If you're feeling pain, ask for something. Okay, in the beginning, they may start off with heavier drugs and then eventually start tapering them off. I know within a couple days I was on lower level painkillers, and by the end of the week that I was in the hospital and sent home, I was basically taking basically over the counter stuff. So the pain does get better, but you need to stay on it. There's no stigma if you ask for something to help you. The nurses and doctors understand this is not an easy procedure to go through. To have your breastbone cracked open, your skin, the muscles, all of this is going to take time, to heal. Another big shocker in the recovery phase of this is understanding your emotions. I can't explain it, but I see this happening all the time. People discovering that all of a sudden they have emotions that they weren't aware of. Okay, this is a traumatic surgery to the patient, physically and emotionally. You're knocking on life's door, or the end of life, as far as that goes. So it's traumatic. So don't be afraid to reach out and speak to any kind of therapist, counselor, whatever. Okay, what you're feeling at that point, if you do feel that, and probably chances are good you will, ask to talk to somebody. It's well worth it. So the next question is, when do things get back to normal? That's up to the individual, and all how you go through the different processes and your follow-ups and rehabs and things like that. I can tell you that for me, it took about 3 to 5 months for me to finally be in a spot where I felt I was no longer rebuilding myself or repairing myself. Okay. The first question, diet. Again, that all depends. I was not put on any kind of special diet, which you would figure somebody with heart issues would be, but it really depends on why the heart surgery was done. Okay, if you were getting this surgery because you were pushing donuts and cheesesteaks and cheeseburgers and French fries and stuff like that and smoking, yeah, then you're probably going to be put on a fairly strict diet. My need for the heart surgery was tied to my cancer treatment 17 years before that. So, really, diet wasn't going to have an impact on my recovery. Although, I'm sure my doctors would prefer that I would try to eat as healthy as possible. Of course, no smoking. They're always going to recommend that you quit. The other big one, alcohol. When can we drink alcohol? In all honesty, it's not a good idea. Now, yeah, there's some reports that you can have one occasionally, and I don't know that that's necessarily a bad thing. That's what I do. If it's with a certain meal that I want that flavor, but I don't have to have the alcohol. Besides, you're put on medications that may be impacted by drinking alcohol. Alcohol itself will cause damage to the heart. It will affect the heart negatively, and you don't want that. So, um, it's everybody's choice. You know, you're a grown up. We put the information out there. You do with it what you want. But I personally don't recommend going out, hanging out in bars and stuff like that, drinking. Occasionally I don't know that it would be a problem or not. The other big question that comes up: rehab, doing cardiac rehab. Now, unfortunately, not all doctors actually recommend this, and it's frustrating for me because I've gone through 3 heart surgeries, and all 3 heart surgeries I completed cardiac rehab. And there's a huge benefit to this. And it doesn't matter, if you're Mr. Olympiad, running triathlon, doing triathlons and all that other stuff. You've had your heart repaired. Okay, there's been damage done and needs to be slowly recovered from. Okay, so you need help monitoring that. And you're not going to get that if you go to your local gym, or, if you have a weight room in your house or whatever. But you go to cardiac rehab and you get connected to telemetry, okay, which goes over to a computer area where there's either a nurse or a technician that is watching a pre-built exercise program for each patient. And it could be a hand bike, it could be an exercise bike, it could be a treadmill. But while you're doing those exercises, that person is looking at the screen, at watching your heart rhythms and stuff like that. And, God forbid they see something, they can stop you before anything else progresses. And I will tell you that I've seen that happen several times during rehab. It's never happened to me. I've been lucky that way. But I've seen other people had to stop their cardiac rehab because the nurse or the tech saw something. Again, and this isn't something that these people felt. They had to be told to stop. So if you're in the gym doing your own thing, chances are you're not going to feel something going on with your heart. That only shows up on a monitor. This is the benefit to having cardiac rehab. Okay? And I can't stress it enough. If you have the opportunity to do it, do it. It will go roughly, I think, 12 weeks, 3 times a week, 2 to 3 times a week or whatever. But do it. If you've got the insurance to cover it, do it. If it's near you, do it. Okay? Next big question that comes up: driving. Okay? I was told 8 weeks, and that's what I did for me. And this is the why it was explained to me that way. Okay? You have major surgery here. Okay? Your breastbone has had to heal. You're driving, okay? What are you doing? Your upper body has to twist and turn. Oh, yeah. And you have to be able to flex this way. You can't do that while this is healing. Okay? That's why they recommend you wait. Oh, yeah. There's also the issue of mentally having your head aware of traffic signals, other people's driving, and things like that, and then being able to react physically. So they likely won't approve you to drive until at least 8 weeks, which, by the way, also is once you start doing rehab. Flying, I was never given restrictions against flying. I personally flew, and my cardiologist knew it. I flew about 4 months later. There were no objections to it. Now, I don't know about flying sooner. Flying is a question you have to ask your cardiologist if it's okay for you to fly. There's the fear of blood clots depending on your medication, and of course the healing itself. You've got cabin pressure. All these things have to be considered, best decided by your doctors. And the final thing: weight limits. When can I start lifting things? Because you're usually put on a restriction of 5 pounds, eventually upgraded to 10 pounds. That's going to depend on how you progress with your recovery. And again, something decided best by your cardiologist. I personally had to have a work evaluation done because I worked with very heavy equipment. And when they did the investigation, even though the equipment I used was on wheels, they described my weight load as 1,000 pounds, especially using torque pressure to move the equipment. So it was a while before I was able to do that, and that might have been why my recovery took longer. So that's a very quick, rapid explanation of recovering from open heart surgery. Until next time, this is Paul's Heart.